performed tracheostomy suctioning on Mr. Jones, and I compared the respiratory assessment before and after the suctioning, and now I'm going to be performing tracheostomy care. So the first thing I'm going to do with my clean gloves is set up my sterile field. So I'm going to move this over here. I'm going to peel this back. I'm touching the outside 1 inch border. I'm going to take up my sterile field and put the shiny side down because that is the water resistant side. Next, I'm going to dump my contents onto my sterile field. Careful to not touch the 1 inch border again, or at all. I didn't do it the first time. And now I'm going to get the saline solution and pour it in, recapping or uncapping with the palm and with the label in the palm of my hand, pouring without splashing. And recap. So the first thing I'm going to do to Mr. Jones is should I do this box so I can get some. Okay. First thing I'm going to do is take off his oxygen mask and secure the face mask and remove the inner cannula. And I'm going to avoid my sterile field and drape it or drop this into the first saline solution. Now I'm going to secure my face mask again and take off the gauze and recap the oxygen mask. Okay, so now what I'm going to do is take off my clean gloves, glove to glove and skin to skin, and I'm going to put on my sterile gloves. Now my hands dry out, okay. And I'm gonna go ahead and pick up my first glove. Oh, should have let them dry out some more. Okay, that's all right. I will just pick it up. My thumb is up, but it's kind of drooping to the side, but nothing is breaking sterility. Okay, so now I'm going to finally be able to reposition them. I'm careful to only touch the outside of my gloves and not touch my gown. Okay, now these are for the most part good. My hands are just really sweaty, so. Okay, now I'm going to reposition everything in my sterile field. Okay, so I'm not touching anything in the 1 inch border or on the 1 inch border. I know maybe camera angles can be deceiving, but nothing is on the 1 inch border. Okay, so the first thing I'm going to do is take out my brush and pick up my nasal cannula or inner cannula and move it over here and scrub the inside of it and then scrub the outside. Now I'm going to dispose of my brush without breaking sterility, and I'm going to put this cannula in the second saline solution, and then I'm going to dry it when I pick it up again, first with gauze. So I'm just going to get this, pick it up, and dry it over my gloves. throw the gauze away. And then picking up my, where are they, pipe cleaners. They're in there, I just saw them. I thought these were my Q-tips for a minute. Okay, so now I'm gonna dry the inside of my inner cannula. I'm just laughing at that mistake. Okay, so now I'm going to replace my inner cannula. I'm gonna remove the oxygen mask and replace it by putting it in a 9 o'clock position and turning it to the 6 o'clock. And now that it's locked in, leaving it there. And I'm not going to return the oxygen mask right now because I'm actually going to take my Q-tips and dip them in my third saline solution and clean from the inside to the outside, around the stoma, the faceplate, and then the facial ties. So I'm gonna go under the faceplate in a circular motion, 2 to 4 inches around it. And then doing the other side, 2 to 4 inches around, or all the way around the stoma, and 2 to 4 inches circular motion inside to outside. And while I'm doing this, I'm also going to be observing for any irritations of the skin, like blistering, erythema, discoloration, or secretions. And I'm gonna throw this away. And next thing I'm gonna do is pat my area dry. And throw that away. And now the sterile process is complete, so I won't have to worry too much about that. And I'm going to redo the ties. And the first thing I'm going to redo is not take off, I'm gonna get my new ties and put them on first. So I'm actually using this shoelace. I pre-measured the tie already in there and it was not big enough. So I'm gonna reach over my sterile field now that sterility, I don't have to have a sterile procedure anymore, and use my clamps to go up through, securing the face mask so it doesn't irritate the patient. And I'm going to make one side longer than the other. I'm gonna go around his big old neck. And I'm gonna take this one and push it through the inside. Securing the face mask so it doesn't agitate his skin. Pulling it through, securing the face mask. And now I'm going to drape that down so I can double knot it. Okay. Boy. Okay, so now I'm going to make sure the 2-inch, the width around this new face tie is big enough for my 2 fingers to fit in, and it is. And so that means I can take off the old face ties by securing the face mask while I'm doing it again. Okay, and I'm gonna throw these away. And I need to replace the, I'm going to replace the gauze next under Mr. Jones's face mask, or face plate. All right. Okay, so now I'm going to return oxygen to Mr. Jones. I'm sure he appreciates that. And I'm going to take off my sterile gloves and put on clean gloves. So glove to glove and skin to skin. And let my hands dry again. And now I'm gonna put on my new gloves. Well, actually, yeah, I'm gonna put on my clean gloves that are in this kit. And go ahead and put those on. Okay. So now what I'm going to do is, I have my clean gloves on, and I'm going to remove the drape. I'm going to compare, I'm going to, before I remove the drape, perform a respiratory assessment on Mr. Jones and compare his respiratory rate to now and before the procedure. And then I'm going to make sure everything's okay up here. And then I'm going to perform oral care with either a toothbrush or a oral swab with chlorhexidine mouthwash or chlorhexidine rinse. Okay, and now I'm going to take off the drape. Okay, and now I'm going to raise the head of bed to 30 degrees and lower the bed. Oh wait, before I lower the bed, I'm going to raise the rails, the side rails, and then lower the bed all the way down. And then I'm going to take off my, all of this. So I'm going to start with gloves. And then gloves, goggles. Okay, goggles. And then I'm going to take off my gown. And when I do this, I'm only going to touch the inside of my gown. So I'm going to start up here, only touching the inside of it. And going ahead and bundling that up on the inside only. I think I would normally dispose of it. And then take off my mask. And now I'm going to chart or document the procedure, but before I do that, I'm going to perform hand hygiene one more time, since I just took off my PPE. And then I'm going to document the procedure and how the patient responded and his respiratory rate and any problems that he had. Then I'm also going to document any type of secretions that I found or any skin irritations, and I'm also going to document the type of, in response to the tracheostomy care, the type of tubing and the size of it, and then how his skin looked around the area, and I think that's it. Just make sure to document that as well. Okay, the end.